We have specialized programming for our patients. It's important to us that we're able to cater to the needs of every individual that comes to treatment. We also offer services for our veterans. Our veterans come to us, and we offer specialized veterans group, a pride group for those that may be of LGBTQ population. We certainly want to have everyone feeling comfortable as they come to us. Also, we offer our clinical specialists, which I think separates Retreat from other facilities. So above and beyond a primary therapist who works with an individual when they come to treatment, our clinical specialists really provide an opportunity for those complex, deeply entrenched issues that will need a little bit more attention when they come to us. So we really value the importance of individualized treatment. We offer 6 different specialized track groups. These tracks were implemented because although we can identify as addicts or alcoholics, we also have underlying things that come into play as it pertains to our addiction. Each one of our track groups have specific curriculum, psychoeducational material, as well as the way we process in each group. Our hope, our first timers in treatment, we certainly want to provide education about what it means to be an addict or addiction, as well as the services that are offered to us in the community. Our Quest group is grief and loss. So oftentimes we have these losses in our life that we just do not want to talk about, or we don't want to feel it. This track allows for a safe place with others who have experienced grief and loss, so that I can begin to explore mine as well. Co-occurring mental health is, we're very involved, our clinical department and medical team, as it pertains to our mental health, meaning we offer psychological services as well as treatment planning. Our trauma track specializes in our ability to allow the patient to explore those traumatic experiences. This includes exposure therapy, experiential therapy. We also have our Truth and Odyssey tracks. Odyssey are alcoholics. Odyssey is for the alcoholic who has at times been in treatment before, so we want to continue the recovery process. Even if there is a relapse, we can always start again, and we want to continue to explore different coping strategies. The Truth track, for our opiate users, we know that this is devastating our community, so we really want an intensive program with multiple services to allow a patient to begin to recover. With that track, we also offer clinical specialists so that we can be more intensive in nature, exploring the reasons why we're using opiates. When a patient comes to us, we begin assessing their needs right away. From various assessments that we have on hand, we identify a track of which the individual might best be suited for, meaning their needs may certainly overlap from Explore, co-occurring to Quest. However, amidst the assessments, which is a needs-based assessment, we have identified that this track better sets someone up for success as it pertains to their recovery. So these tracks allow for a space for someone to identify with others who also may be going through similar circumstances, because oftentimes I feel as though I'm alone with these feelings or thoughts that I have, and that's not the case. Treating each patient as an individual is so important to us. In fact, when a patient comes to us, that's a request. We try not to generalize this disease of addiction. For everybody, it's so different. The chaos, the damage that ensues in one's life is similar, but the circumstances leading up to or bringing an individual to retreat are very different. So our hope is that we can stabilize and provide some type of plan so that when a patient returns home to their family or to their lives, that they have the circumstances in place to help them with those individual things that contribute to one's use. If we generalize this disease of addiction, then that leaves someone, in theory, that leaves that individual leaving here without an individualized plan to address the things contributing to their disease in their life. So we really strive to have individuals meet with their primary therapist and their treatment team to identify those players or those circumstances in their lives to better their success of and hope for recovery. Retreat offers holistic experience to our patients. The reason for this is our patients often need different coping strategies in their lives so that we don't resort back to our drug of choice during times of difficulty. Additionally, in our addiction, active addiction, we at times lose a sense of what we like to do or that creative passion that drives us. The holistic approach allows us to re-identify with things that make us happy. A patient's primary therapist is the center of their beginning of recovery. When an individual or patient comes to a retreat, they are assigned a primary therapist right away. And the goal of this is to really begin building rapport day one, building a relationship day one. We want to identify as someone that's going to help us begin to traject up. Beginning day one, when a patient comes in our door, we have them sign consents to disclose information. Now, what that means is we are aware that the patient may not want some people to be contacted, and we want to respect that. We have to respect that. We also know that the patient may be under the influence when they come in, so we will continue to follow up day 2, day 3 to ensure that this is someone of which the patient wants to be contacted. The family is critical and so important to one's recovery. Many suggest that without the family involved, then the patient really doesn't have the full picture of what it takes to recover. Now, there are some patients who do not wish to have the family involved, but we want to help the patient identify the need to have a support system, and that starts with the family. Retreat values family involvement in a patient's experience. Oftentimes through active addiction, we lose sight and touch with our family. Retreat offers multiple services to include the family into one's treatment.